Hi, I'm Dr. Aurora Ongaro, and today I'm going to talk to you about pillows. In our office, we get the question about what kind of pillow should I be using? How do I know what kind of pillow is the right kind of pillow for me? So today I just want to take some time and go through some really loose guidelines that we give our patients on a regular basis. First and foremost, my number one rule with pillows is that it should feel as comfortable or more comfortable with your neck in the morning than when you went to bed. So if you're waking up with a stiff and sore neck 2 or 3 days in a row, then it probably means that your pillow is not giving you the proper support. Most of us have had this kind of thing happen to us when we've gone traveling. You're camping or you're in a hotel room and the pillow just isn't quite as comfortable as your pillow at home. And you wake up and your neck feels kinked, or you feel like you have a little bit of a mild headache or pain behind the eyes. So if you're noticing any of those types of symptoms, it's time to change your pillow. There's also guidelines from some of the sleep websites that you should be changing out a pillow every 1 to 2 years. The reason for that is first and foremost hygiene. There's a lot of sweat that happens at night, there's dead skin cells, that sort of thing. So you want to make sure your pillow is clean to prevent allergies. But from a support perspective, materials do compress over time, they do squish. So depending on the type of pillow you have, be it feather or down or foam or latex or bamboo, those pillows have a more of a natural range or a creep or compression amount of time that they will allow you to have. So generally speaking, the softer the pillow, the faster those materials will compress, whereas the sturdier the pillow, the longer that pillow will give you. So if you're having something like a synthetic or a down feather pillow, you're probably going to want to switch out that pillow every 6 months to a year, whereas something quite a bit more sturdy like a latex pillow, you could get away with that probably running for about 2 years. From an alignment perspective, what you want to have is a well-supported head and neck position. And then the guidance largely depends on, are you a side sleeper predominantly or a back sleeper? Side sleepers and back sleepers need different supports. If you're a side sleeper, you want to have your nose or the center of the bridge of your eyes more or less in line with the center of your breastbone. If you're in that position, it means that your head and neck are supported this way when you're laying on your side. So a good way to monitor that or check that for yourself is once you get into bed, have a family member or a friend, just check and see if once you get comfortable, are you still in a straight line. Another thing you can keep an eye out for is if you are sleeping and you find you're continuously tucking your arm up underneath your pillow to support your head and neck while you sleep, your pillow's not high enough. Conversely, if your pillow's too high, that's going to strain your neck, and that's where you're probably going to notice some of those kinked necks. You also will wake up with a stiff neck if that pillow is too low and if you're falling into the mattress every single night. If you're a back sleeper, the guideline is a little bit different. You want to make sure that when you're laying on your back, your ear is either in line with the center of your shoulder or just slightly in front. So you don't want your head being pushed too far off of the pillow. The challenge is if you are somebody who turns from side to back and side to back and you change a lot, finding that sweet spot in terms of the height of the pillow. Some of our patients love the cervical contour pillows. Those are the ones that have the build up on the side and a little cutout for the center of your neck. Some of our patients prefer other types of pillows to give them the support they want and need. It's a little bit of trial and error. We can't tell you any one pillow is going to give you a great night's sleep, but if you keep an eye on how you're feeling in the morning, that's a pretty good guideline of whether or not you're being appropriately supported. I hope that helps and answers your question. If you have any further questions, you can certainly give us a call at the office or check our website or send us an email. Thanks, have a great day.